So hi, good morning. So I'm gonna perform auto scenarios. So I got called from the patient's the ninth floor. So when I was about to go to the patient's room, I make sure to check the patient's chart, and then before going in, I make sure I have to wash my hands, and then once inside, introduce myself, and then explain to them what I'm trying to do, what therapy, such as telling them that the doctor would like to provide you with an oxygen, and then it would help you with your oxygen level and also with your breathing. And then after that, make sure to check the ID band to know the exact patient before putting up or hooking with an oxygen device. Do my set of vital signs such as a pre-assessment, and then we can move on. So the doctor would like the patient to be hooked up with a venturi mask because the patient is chronic CO2 retention. So immediately we set it with a flow of about 28% FiO2. So in that way the patient would be able to receive precise FiO2. So first thing is try to loosen this one first and make sure we fill it if there's air, and then try to tell to the patient that this is kind of a little bit noisy, but it would help with them, it will benefit especially their CO2 retention. So try to put this one, make sure it's being properly sealed their face. Then make sure that they should not cover it with any blankets or not obstruct it even with their hands, and also this one should be not kinked. So try to observe the patient and then document it. And then in a few hours, I received a call from the floor that the patient, they noticed, especially the physician that and the nurse in charge, that every time the patient would try to cough or even try to eat, the patient would turn to cyanotic, and then their condition would worse, such as they will be delirium, even though if they will try to remove this one. So I immediately tell to the staff that if the patient would try to remove it, they should attempt to still be hooked up with an oxygen, just to prevent from that kind of situation would happen. So immediately I try to tell them that there's an oxygen nasal cannula that I try to prepare in case, and then make sure that we tell them that with a flow of 28%, so the ideal flow for nasal cannula, just to have the same FiO2, is try to times it with times 4 plus 20. So immediately I recommended it at 2 liters, so it is equivalent to 28%. So I also try to teach to the nurse that how to properly insert it and how to tell to the patient that they should not put any oils such as Vaseline. And then I already told to the patient, relatives, and even to the staff that I already put up a no smoking sign also outside. So make sure that they should not forget about hooking it to the patient with a nasal cannula, especially if the patient would like to eat or attempt to remove the venturi mask. So this is just a precaution, and then make sure the patient is comfortable. And then after being hooked up, try to observe the patient, and then make sure we do another set of vital signs, assess them, check the SpO2 level, even though kind of decrease a little bit, but still at least the patient's receiving oxygen. It is just for a precaution, just for a few minutes. So after that, go outside, but before that wash our hands, and then make sure we chart everything, that what our initial observation is, and then make sure with that to remind the staff not to forget in hooking up with a nasal cannula every time the patient would remove during eating time or if they attempt to remove it.